So due to a language barrier, I'm going to speak a little bit on her behalf. So during the consultation, what we found is that 2 years ago during a bicycle accident, she experienced some discomfort in her elbow and progressively gone to a point where she can't fully extend it. So go ahead, show. Right. So this is pretty much as far as she could extend. She can't completely straighten it out. Right? Can you try? Okay, and then try to extend. Yeah, that's pretty much her limit. And same thing, let's show them what you could do with your wrist. Okay, can you do this? Yeah, see, it's completely locked up. Straight off during standard palpation, what we're feeling right over here, there's some swelling right over here. We have some swelling, edema, right at this location here as well. And we have some pooling, swelling in this location as well. So when we take a closer look, how is that? Pain? Dolores?
No.
Poco? A little bit?
Poquito, yeah.
Poquito. Okay. Because when we challenge this and test this structure over here, this is stuck. There is pretty much no movement. How's this one here?
Pain.
Pain. Okay.
Yeah.
How about this one here?
I pain.
Huh?
Pain.
Pain.
Yeah.
Got it. Pain right here?
Yes.
Yeah, number 6. All right. This is your right wrist. This one over here. This is what normal is supposed to look like. See all these? We want to see all these joint spaces and all these bones. This one over here, it looks like almost one bone. In addition to, you see how white this is? And this is less white. Right? That means it's what we call osteopenic, right? Meaning you lost a lot of bone in this region over here. When we take a look at your elbow, it's starting to have a similar problem in progress as well. Not as severe as your right wrist, but it's just beginning to. So this particular problem, where almost all the bones are fusing, all the the swelling and the loss of bone structure over here, and the pain pattern you talked about before, is what we call reflexive sympathetic dystrophy, RSD for short. These days they call it a different terminology. Now it's called complex regional pain syndrome. I understand she feels problem here and here. The problem's not here. It's here. Because problem over here not working right, it's a loop. Keeps on looping. It should be just like, do this, one, stop. No, it keeps on looping. Keeps on going. Resulting inflammation. That's why this is swollen. That's why this is hot. Feel this? Cool.
Yeah.
Warm. 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 Cool. Right? This is very warm. This is not normal. Exactly. So because keeps on doing that, activating sympathetics over here, that's why all this inflamed. And inflammation, eventually what happened was weakened all the bones on here and made it very, very weak. And also all the bones start fusing and locking like this. So that's why it doesn't move.
Yeah.
That's why this one's very, very stiff to move around. So this one over here, you're gonna need physical therapy in the future to try to rehabilitate it and make it stronger. My job right now is we're going to restore and correct the dysfunction to your nervous system here so we can turn off the signal so it doesn't become hot. Do you understand?
Yeah.
Yeah. We cannot fix this. This is not where the problem is. The problem's over here. Here's the strategy with this case over here. Because the problems with the sympathetics are over here. Now because of the way the biomechanics, what we see over here on the film, her overall spine is twisted like this. So we need to restore this fellow over here. and try to realign it as much as possible and reduce the obstruction to the nerve system in this region over here.
Siente bien.
What did she say?
She is feels good.
Okay.
Good.
No, that's fine with me. That's fine. Good. Okay, let me check the
Yeah.
wrist. Feel the difference over here? This is cool. Feel this? This is starting to get a little cooler now. Feel it now?
Sientes que está frío, dice.
This is cooler. This is still warm, but not as warm as before. Do you feel the difference now?
Yeah.
Relájate, pero.
How's this feeling now?
Yeah, it's cool. No more hard.
No more hot, right?
Yeah.
Good. Now try to see how much can you move.
So,
Still stuck, right?
yeah.
All right. Dolor?
Yes.
As we see over here, there is a lot of swelling right in this region over here. And that's the result from the RSD. So we're going to be very gentle. We're not going to try to move the structure whatsoever. All we're going to do is just pump some of the edema out of the way and cause a little mobilization. All we want to do is stimulate the nerve system, wake it up, let it know this is where normal is supposed to be.
This is not different, this is same.
Hmm?
This is not different, this is same.
And that's what she says?
Yeah.
Okay.
Yeah.
No, I understand that. Because like I says, there's a lot of damage going on due to the RSD itself. It actually changed the bone structure here. And so it's going to take some time. Because that's why we need to address the root cause here to turn off that reaction. Then we can start, getting to work over here. Let's check this one as well. This is the same story as well. Because there's no way we're going to try to move this. Okay, no. I'm not going to try any more than that. Alright, so because the damage there is extensive, what we need to, again, correct this over here, turn it off so it can start cooling down so it won't overreact. There's two homeworks you need to do. Number one, omega-3s.
Okay.
There's a lot of inflammation. Omega-3 fish oil is one of the strongest anti-inflammatories you could eat for your body.
Okay.
And it'll help repair some of this damage over here. We're not saying 100%. The damage here is very extensive. And I would also recommend physical therapy. Once it starts calming down, we'll refer you to a physical therapist so you can start rehabilitating these two joints. Number two, we need to cut the sugar out. Right. Sugar, what happens is it converts and it fuels the inflammation and the pain. So if you keep on eating sugar, you're going to have more pain in these areas. And as in other words, it's going to make these two worse. So not only just simple sugar, we're also talking about anything you eat for carbohydrates, meaning bread, rice, pasta. All of those get converted into sugar, and it'll make this worse.